There have been advances made in treating pancreatic cancer that mean there is hope when that is the diagnosis given. Dr. Steven Steinberg of Boca Raton Regional Hospital joins us to answer your questions. Thank you so much for your time. We appreciate you joining us with this information. First, let's talk about who's at risk for pancreatic cancer.
Well, I think the people who are at risk are smokers, another good reason to stop smoking. People who drink too much alcohol can be at risk, and other patients who have inflammation and irritation of the pancreas chronically. And then there's a small group of patients who have a familial disposition, familial risk for getting cancer of the pancreas.
What are the symptoms?
Unfortunately, the symptoms are really minimal or even non-existent until the disease has spread to some degree. People may experience pain. They can actually experience blockage of the bile duct, which can cause them to turn yellow. But again, unfortunately, we don't have early signs or early markers that allow us to catch this disease in the very earliest stages.
Now, you're an expert in treating diseases of the pancreas. Does that always mean cancer?
It doesn't, and I think that's really important. When people hear about a problem on the pancreas when they've gotten a CT scan, a CAT scan, or an MRI for some other reason, they immediately think that this must represent a malignancy. And the fact is that we see lots of patients who have cystic disease of the pancreas, fluid collections that can look like masses or look like a problem, but that actually turn out to be something that overall doesn't impact their lives.
And as I mentioned very briefly in the introduction, the diagnosis of pancreatic cancer usually just sounds grim, and it's usually been a pretty dire diagnosis. But there's actually been some advances made. Tell us a little bit about advancements in treatment for pancreatic cancer that's offering hope to patients.
Well, I think there have, and I think that probably everybody's aware that the gold standard of treatment of cancer of the pancreas is surgery, to take the cancer out. And we've been doing that for the better part of 75 years, and our techniques with respect to surgery and getting people out of the hospital quickly and things of that sort have really improved, but the outcomes haven't. And so we've now taken a different approach. And the problem with this disease is that oftentimes the cancer spreads early. Tiny little cells will implant in the liver or elsewhere. And so what we've taken to doing is to be giving chemotherapy, drug treatment, either before or after surgery for cancer of the pancreas, with the aim of eradicating those tiny little islands. And with that kind of approach, we've actually got patients who survive 10 years without any disease, which would be a pretty good definition of a cure.
That's amazing. Now, how new is this type of treatment, the combination?
Well, I think the combination has been thought of for a good while. It's used in other kinds of tumors. So, for example, that's the kind of approach you'd get if you had a cancer of the esophagus or the colon.
What, any other treatments too that you're working on, studying, that you're seeing some positive outcomes?
Yeah, I think there are other approaches as well. With the latest advances in radiation therapy, we can now do targeted treatment. We can put seeds that allow the radiation oncologist
like prostate cancer.
Like prostate cancer. There are now some biological kinds of approaches to using biological treatments for tumors. And we can even use what's called radiofrequency ablation, high-frequency radio waves to ablate the tumor.
A lot more hope than a few years ago. Thank you, Dr. Steinberg, for your time. Dr. Steinberg, sponsored by Boca Raton Regional Hospital, which also underwrites our Ask the Doctor segment. Back with more in a moment.